What is bed mobility? The term bed mobility refers to activities such as scooting in bed, rolling or turning from lying on one's back to side lying, or side lying to sitting and sitting to lying down. It also included scooting to sit on the edge of the bed when preparing to stand or transfer.
Patient to the edge of the bed. Always introduce yourself to the patient after entering the room. Explain the procedure and how the patient can cooperate. Side rails down for your side. Roll down the top sheet. Ask permission before removing the pillow and put it against the head of the bed. Positions on moving is either linear or crescent shaped. Linear position is where we move the patient's head first, then pelvis, then feet. Put the pillow back. While crescent shape, we move the head first, then the feet, then the pelvis. After positioning the patient, put the pillow back on. Always provide safety and comfort for the patient. Side rails up and put the top sheet back on the patient. To the edge of the bed using draw sheet. Roll draw sheet and tuck it under the patient. Always ask for permission whenever we do procedures. Remove the pillow. Arrange patient's arms and cross patient's feet. To pull the patient towards you. Arrange or set the draw sheet for you to turn the patient back to supine position. Put the patient back to its comfortable position and also arrange the pillow. Roll draw sheet as close as possible to the patient's body. Then with your palm facing upward, pull the patient towards you. Observe proper body mechanics. Remove the draw sheet after using. and place it on the laundry hamper. Position patient back into a comfortable and safe position. Place the pillow back on the patient's head and then side rails up. Put the pillow against the head of the bed to protect patient's head. Ask the patient to bend her knees with her feet and hands lay flat on the mattress. Explain the procedure to the patient. Insert your arm under the patient's thighs as well as patient's shoulders. Instruct the patient to push herself upwards on the count of 3. Arrange the patient's pillows as well as the patient's legs. Side rails always up after the procedure. Up in the bed with one person. Always secure the bed before starting the procedure. Always make sure that the bed wheels are locked. Remove the pillow. Stand at the top of the bed where the patient's head is. Roll draw sheet with palms facing upward. And then on the count of 3, pull the patient towards you. Put the pillow back to ensure comfort and safety. Up in the bed with 2 persons. 2 carers will stand on each side of the bed, then side rails down. Remove the pillow. While patient's arm is placed across her chest. The 2 carers will grab the sheet at the patient's upper back and hips. Observe proper body mechanics as you pull the sheet upwards. Put the pillow back on the patient. Remove the sheet afterwards. Side rails up to ensure safety. Log rolling. 2 carers will stand on one side while the other carer on top of the patient's head. Remove the pillow and put patient on lateral position while following verbal cues. Support patient's head, back, and lower extremities with pillows. Side rails up after doing the procedure. Sitting patient to the edge of the bed. Remove the pillow. And then pull the patient to the edge of the bed. Always observe proper body mechanics. Explain the procedure to the patient. Place one arm around the shoulder and the other under the patient's thigh. On the count of 3, Instruct the patient to sit on the bed. Keep supporting the patient. Assuming standing position, ask the patient not to move around while you adjust the patient's bed. Height of the bed is up until her feet can touch the ground. Put on patient's shoes or slippers. Stand between patient's leg to support the weak leg. Let the patient put her hands on your shoulder while you hold her waist. On the count of 3, let patient sway towards you to stand. Move closer to the patient for stability. Observe proper body mechanics. Bed to wheelchair. Place the wheelchair parallel to the bed as close as possible. Lock the wheels and raise the footplate off the wheelchair to ensure safety. Assist the patient to assuming standing position. Observe proper body mechanics as you walk towards the wheelchair slowly, with patient's strong leg first and then the weak leg. Let the patient hold onto the armrest when she feels the chair on her popliteal. Help patient to sit and ensure safety and comfort by lowering the footplates. Put the wheelchair close to the bed and then lock the wheels of the wheelchair before adjusting the bed to a safe working level. Raise the footplates and instruct the patient to scoot over the edge. Put your arms on her waist as she puts her arm on your shoulder for support. On the count of 3, help the patient to stand. Walk with the patient until you reach the bed. Let the patient to extend her arms backwards for support as she sits on the count of 3 as instructed. Tell the patient not to move to set the wheelchair aside. Remove the patient's shoes. And then help the patient in lying down to supine position. Ensure patient with comfort and safety by putting on the top sheet. Side rails always up after doing the procedure. Always ask if patient have other concerns, and then ask permission to do aftercare before bidding goodbye. Always perform medical hand washing before and after leaving the room, then record and report.